Good Friday afternoon. I'm Charity Menefee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is dedicated to our epidemiology team, who at this point have monitored more than 1,200 contacts to cases. To be clear, these are not all confirmed cases. They are contacts to confirmed cases who have been exposed to the virus. Our team followed up with every one of these individuals through their quarantine period and provided guidance. And this is extremely significant because through contact tracing and monitoring, the risk of transmission is lessened. I am so proud of this team and the work they've done and will continue to do. Moving into our local situation, we have 375 confirmed cases of COVID-19 in Knox County. Additionally, we have 11 probable cases. 321 of our cases have recovered. 41 individuals have been hospitalized at some point in their illness. 3 Knox County residents are currently hospitalized. And we're also thankful to report that we have no additional deaths due to complications from COVID-19. Now we'll transition to the benchmarks. As a reminder, for the majority of the benchmarks, what we want to see is no 3-day statistically significant shifts within a 14-day time period. Every day we look back at the previous 14 days. That's what a rolling average is. Overall, what we mean by this is we are trying to see, are things staying the same or are they getting worse? And if so, how much worse? Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. This week, we experienced a 3-day statistically significant increase in new cases. These increases caused us to represent this traffic light as red. As we mentioned earlier this week, this increase is concerning, but it's important to remember that because our case increases have been so low, even a slight increase in new cases would register statistically significant. To put this in perspective, if you look at the y-axis or the vertical line on the chart, you will see that the maximum number of new cases we have received in one day is 14. While this is an increase in what we've been seeing, it is still a relatively low number. That means we are continuing to respond effectively. As we mentioned that we would be doing, we have brought in additional KCHD team members in an effort to be prepared to effectively complete investigations and contact tracing in the event our growth rate continues to rise. You'll see that reflected in the third benchmark. On our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows tests conducted for Knox County residents and another for average time between specimen collection and lab report data. What we want to see is testing staying the same or going up and reporting time staying the same or decreasing. Based on the qualifications we mentioned for a shift in traffic light colors, looking at standard deviations, this benchmark meets the qualifications for green. On the third benchmark, sustained or increased public health capability. This chart shows the number of individuals currently on the epidemiology support team. To be prepared for a potential increase in new cases, we have expanded our epidemiology team from 31 to 35 people. 2 of those individuals came from our already trained and available KCHD Epi support team members, and the other 2 individuals came from the additional KCHD team members that can be and were trained to provide Epi support. At this time, we are adequately prepared to continue handling the current contact investigation volume, and this benchmark meets the qualifications for green. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. This data is gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System. It may reflect Knox County, East Region, or patients from other jurisdictions. From this benchmark, the traffic light remains green. In full transparency, we did experience a few days of statistically significant increases in positive hospitalized patients, ICU patients, and ventilated patients. However, because this number is so low to begin with, even a small increase registers as statistically significant. To better show you, we'll talk a little bit about the data that we saw this week. This week, the most COVID-19 patients that we saw in the entire region, which has 19 hospitals, was 10. The max number of ICU COVID-19 positive patients was 6, and the max number of COVID positive ventilator patients was 3. These are low numbers, and for that, we are very thankful. As always, the decision to keep this traffic light green came after talking with hospital partners and getting their input, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-related death rate for identified positive or probable cases. For this benchmark, we show a chart that details cases, hospitalizations, and deaths. This benchmark remains green because we thankfully have not had an increase in deaths. Before we open it up for questions, I want to spend just a few minutes talking about our hospital emergency departments. We want to stress that if you are having a health emergency, hospital emergency departments remain safe places to go. Please do not delay seeking care if you are having an emergency. At all times, but especially during the pandemic, our regional hospitals are following proper guidance and recommendations to ensure their patients are protected. Now, just a note of housekeeping. Beginning next week, we are moving to a 3-day-a-week media briefing. These media briefings will take place at 12:30 p.m. on Monday, Wednesday, and Friday. There will still be an opportunity for media members to submit their questions on Tuesdays and Thursdays through our Joint Information Center. More information will come out on that via email today. This shift is being done to be judicious with our time while also moving towards the ability to offer more individualized and specific interview requests, as we've received a bit of those requests over the past few weeks. For the general public with questions, we continue to recommend that you call our public information line at 865-215-5555. And now we'll open it up for questions.
And just as a quick moment of clarification for the benchmark number 3, our screen had not been properly refreshed there. So those numbers are updated with our currently designated KCHD EPI support team at 35. So if you refresh your screen, those numbers will be updated. You can submit your questions now, and please go ahead and type your name as well as the media outlet that you're with. First question we have is from Brian Hornback. He says, is it fair to believe that KCHD is more extreme with benchmarking, or are we not seeing the state's benchmarking process and procedure?
I don't really know how to answer that question, to be honest. I think that we're trying really hard. I'll talk about local data to be transparent and open and show our local data and talk about how we're coming to our conclusions with our data that we have. I can't speak to the state data. I would suggest you talk with somebody there about how they're presenting their data. But I don't know about whether it's more extreme or maybe perhaps just a different approach.
From Daniel with WVIR, can we get more clarity on why the COVID case numbers jump as they do? Is that due to clusters, or is it due to delays in testing results?
No, it's a little bit of everything. So it's when people are getting tested, if there's been test events, it can be due to clusters. And I'm glad you asked that question because we're doing our job in a lot of ways when you see more clusters and cases associated with clusters. And I'll explain that a little bit. So we get a case, and we've walked through this before, but we can kind of put it in this perspective now. We get a new case and they're positive, and we do our interview with them. We do our investigation, and we find out all the people that they've been around. And if there is a specific area where they've had a lot of potential close contacts, we reach out to all those individual contacts and perhaps the location as well, whether it's a business or a social gathering or something along those lines, and explain that there's been cases in their or potential cases in their establishment and offer testing there. And that's all about what we do with contact tracing. That's really getting into the weeds of it. But the point of that is to rapidly identify cases and be able to get those people into quarantine, and then if they're positive, into isolation, and then to track those new cases contacts as well. That's the bread and butter of public health, what we do all the time for all outbreaks and all reportable diseases. But that can reflect in our numbers, and we have seen some of that. And then we're not seeing a huge issue with delays in testing. You will see there was a little bit of an increase in time right now, but there's also a lot more testing. There's a huge volume that's been happening across the state right now. But it wasn't a statistically significant shift to make a flag there. So there's a lot of different things, but the cluster piece is important to know and to expect. You're going to see more clusters because as we do our investigations and reach out to more groups, when we look for cases, we'll find them when they've been in contact because this is an infectious disease.
From Blake with WATE, a couple data websites list Tennessee's transmission rate to be 1.06, the highest in the country at the moment. Could you walk us through how this rate is determined?
I would suggest, I know RT Live is one of them that has that, and really look at the methodology on their website. I don't want to misrepresent or misspeak on what their specific methodology is, but we do pay attention and look at those things, but we also report back and want to make sure that we are really looking at what our local data is reflecting, and continue to do that as well.
From Molly with WATE, we've heard there was an outbreak or cluster at Wasabi Steakhouse. Can you confirm or provide more details?
As always, we don't really provide a lot of information on clusters other than to say if we've had them and we're working towards them, and that we will always make public notifications if we need to. So that's all I can say on that.
From Vincent with the Sentinel, is each benchmark equally weighed, or are some benchmarks more highly weighed than others with respect to how phased reopening is conducted?
We really look at all of the benchmarks together, and we're not weighing any more than any of them any more than others, and they all really entwine together. So we want to make sure that we are able to, on the public health side, effectively respond to the cases that we're getting and do it in a timely manner and follow up with contacts and all of the things that come with that. And we want to also make sure that our hospitals are able to take care of the burden of patients that might come in due to increases as well. So we're not weighing one more than the other. We really look at the full picture when we move forward.
Also from Vincent with the Sentinel, since you are adding probable cases to the case count of benchmark 1, will you make daily probable case counts available indexed by date? It would be helpful for tracking how you calculate new cases.
We are making probables, you're saying by date, so we can see if we've had new or less or rolled off. That's really complicated to explain and to demonstrate, because some probables stay probables through their entire period if they've chosen not to get tested. And again, we're treating them and we're using them in our data because we're treating them like cases. They're linked to a known case, they're symptomatic. We're doing everything we would do for a confirmed case. But some probables roll off because they become cases and they get counted that way as a new case. And then some stay through their entire isolation period. So we'll look into that. I think it's a good suggestion. I'm just not sure how well we can make that very clear without giving all the specific details every time on the website. I hope that's understandable.
Blake with WATE, what factors contribute to a state having a high average rate of spreading the virus?
I think there can be a lot of things. So there's obviously, as we've been talking about, and why we continue to encourage the 5 core principles to try to prevent or limit transmission of this disease, there's more interactions that are happening. People are going to work more, they're going to social gatherings more. As we've said, we expect increases, but we're looking for them, we're testing more. I just described kind of the process with when we have more than one case in an area and we do cluster investigations and we're testing all of those people. So there's a little bit of both sides of that. But again, it all goes back to everybody trying to do their part to prevent the spread of this disease. So making sure that you're wearing a mask, that you're staying 6 feet apart, that you're washing your hands, that you're disinfecting surfaces frequently, and that you're not going out if you're feeling sick. That helps both sides.
Another follow-up question from Blake from WATE. What should be done with the RT rate? Should this impact policy decisions or personal behaviors? Should we be concerned by it?
As we've talked about with modeling before and those types of information that's available out in the public, we don't base any of our decisions on one single model or one single data point. So again, we look at everything that we have available, and then we really look very heavily at what is happening on the ground, our local picture.
David with WVLT, is KCHD seeing any hotspot areas of Knox County?
We're not at this point. It's really across the board. So there's been there's cases that might be working with being out in public more for work or being out socially more, or all kinds of different things. We haven't identified one specific area that could be identified as a hotspot. Everybody is at risk. That's the point to make right now. And so again, get back to those 5 core things. There's risk anywhere in the community.
From David with WVLT, how many complaints has KCHD gotten of employees not wearing masks at restaurants as required, or people sitting at bars?
I don't have that specific level of data. We have received since May 1st, 273 complaints. And as of yesterday, the majority of those were restaurant related. We are, as we've been saying, we follow up and we try to educate the staff and make sure that we're making sure they know what the recommendations are and can move forward.
From Daniel with WVIR, does the health department have a message to Tennesseans as the nation, I think they meant to say, hits 100,000 deaths, especially to the people who don't see the severity, since there are around 350 deaths in Tennessee?
Yeah, I think that, again, this isn't gone. This hasn't gone away, but we've been successful in this community and we're very, very grateful for that. But we have had people who have been impacted by this. We have had deaths. We have had people who've spent time in the hospital and all those things, and we don't want it to grow. We want to do everything we can to keep things as level as possible so that we don't see spikes that happen. So we ask that people still continue to take this seriously. It's still in the community, and do all of the things that we've been asking to do to help prevent the spread.
Also from Daniel of WVIR, the state issued summer camp guidance yesterday. Is KCHD issuing something similar for Knox County? Is there any differences?
There is summer camp guidance in our plan as well, and it's on the website. You can look into it. There are some slight differences, and so we'll evaluate that as we move forward. But as of right now, there are some differences, and encourage you to look into the plan that's on our website.
From Daniel with WVIR, high school football practices have started up. What has KCHD talked about with the local district concerning sports activities?
We talk frequently with the schools. They've been a great partner to us, and really in everything we talk to them about, and what they're really stressing and wanting to do as well is, again, follow the guidelines to socially distance and make sure that they're doing everything they can to limit transmission within their activities, any activities to have to do with the schools. And they're on board and completely understand, and are doing a great job in communicating with us as well.
Any other questions? Please go ahead and submit them into the chat feature now. All right, since there appears to be no more questions being submitted, thank you all for joining us. We hope you have a great rest of your Friday and a great weekend, and we will see you on Monday at 12:30.